we're going to go over every single gut disease, a brief description of it, and how it gets diagnosed. And when I say every disease, I mean every single one. If you want to learn how to fix your gut issues, even if you're undiagnosed, check out my webinar after you watch this. So the problem with trying to get a diagnosis just based off of symptoms is a lot of these organs produce the same symptoms. And we can't just look at it and see what's going on because it's behind closed sphincters. So first what they'll do is they'll take a blood test to see if your inflammation markers are high. And if you're still having symptoms, for months and you have high inflammation markers, then they'll try to get you to do a colonoscopy, an endoscopy. So let's start from head to toe. So an endoscopy. So they're going to first look and see if your esophagus is inflamed. If it's inflamed, they call it esophagitis. All that itis means is that it is inflamed. Modern medicine, holistic medicine, they'll treat inflammation like it's the bubonic plague. In reality, inflammation is the only way the body can heal. There's something injuring that tissue. We need to stop the injury, not suppress the inflammation. I talk about this in way more detail in my webinar. So first thing they like to do is an endoscopy, and they might do an endoscopy and a colonoscopy together. Colonoscopy is where they stick a camera up your butt. Endoscopy, they're coming down your mouth, and they're looking around here. Now, somebody might have stomach ulcers or duodenal ulcers. The duodenum is the first small segment of the small intestine. You would think stomach ulcers would form down here, but they never form down here. They're only up here, but they're actually mostly in the duodenal bulb. So they'll look and see if they'll see ulcers. If they do, they'll say, hey, you got stomach ulcers. Or here, hey, you got duodenal ulcers. If it's super inflamed here, they go, hey, you got gastritis. There's also GERD and acid reflux. And that's when the stomach ulcers get so bad right here and the muscles start spasming so bad right here, this sphincter has trouble closing and the acid bubbles up into your esophagus and it's not fun. And this is called the duodenum. And if they find inflammation here, they'll call it duodeneitis. And then here is the ileum, the last part of the small intestine. Now, they can't see this with an endoscopy. They could see it with a capsule endoscopy where they make you swallow a pill and it slowly drifts down and it takes pictures and they can see where that inflammation is. With a colonoscopy, they can get this camera to right about here, and sometimes they can't even get it that far. Crohn's disease gets diagnosed. Crohn's disease means inflammation anywhere from out the butthole on paper, but people get diagnosed with Crohn's disease when they find inflammation here. I don't know why. That's just how they do it, and they can't explain it to you themselves, but that's usually when someone gets diagnosed, when they find inflammation here. Dr. Burrell Crohn's, the guy who discovered Crohn's disease, did not want to call it this. Another way that they find inflammation here in the small intestine is they do an MRI. And I'm sure you can do it with other things like x-rays and stuff like that. They can see the damage happening in the intestines. There's also other conditions here like SIBO. They do that with a breath test, and that stands for small intestinal bacterial overgrowth. There's small intestinal fungal overgrowth. There's also candida. There's also leaky gut. And these are usually diagnosed through stool samples. A lot of these infections are diagnosed through stool samples, but SIBO is done through a breath test. Now, celiac gets diagnosed when they find that the small intestine is beat up and they notice that you have an allergy to gluten. This is another messed up term because since the dawn of time, celiac was Greek for abdominal. So, and then in the 1950s or 70s, they just changed the term to gluten intolerance. So it's when you have an intestinal reaction to gluten, so you get diarrhea or something. So they diagnose colitis with a colonoscopy. They look up here and they see if it's inflamed. And if the whole colon is inflamed, they call it pancolitis. If it's inflamed and bleeding, they call it ulcerative colitis. If it's just here, they call it sigmoiditis. If they find little pockets coming off, they call it diverticulitis. If the inflammation is just here in the rectum, they call it proctitis. Hemorrhoids, they can just put a little scope up here that sees to about here, and they can see if you have an anal fissure opening. Abscesses kind of get trapped, or they're hard to see, so I imagine you can only see, maybe you could kind of see it just looking at somebody if the abscess is big enough. But if it's a small abscess causing a lot of troubles, maybe they got to do an MRI or an X-ray to see what's going on. It's just trapped pus and blood that can't get out. Perianal fistulas are, they identify with the scope. Sometimes you can just feel the track underneath your skin. You can just feel around for it, and you can feel it. You're like, oh wow, like what's that track doing there? Hemorrhoids, sometimes you can just see them. Anal fissures, sometimes you can just see them, and you don't need like a scope to back it up, but sometimes you do. Things like E. coli and C. diff are identified with a stool test. And then there is another condition called BAM, or bile acid malabsorption, and I really don't even like that name, but it's when, let's pretend your stomach's your liver for a second, and there's like a gallbladder here. It's when the gallbladder keeps dumping bile into your intestines and giving you this super green, smelly diarrhea, which can be, see, like a lot of these conditions can overlap. You could have colitis and Crohn's disease and stuff going on in your stomach. That's what I had. And the bile. So there's like a lot of different things. So it's like good to check. A big part of me getting better was the work of Dr. Hammer. He could look at your brain CT scan and know exactly what gut health condition you had, without doing all this evasive stuff. Sometimes we got to do it in combination. And essentially what he discovered is that disease always starts after a traumatic event. This traumatic event threw our gut into overdrive. And now for the intestines, it's like, what was something important to my survival I couldn't absorb? And usually it's like a boyfriend or a girlfriend or money, like losing a job or getting kicked out of school. Like the gut symptoms always start after a traumatic event, and most of the time people are not aware. Like I wasn't aware for the longest time, but I had really bad anger and frustration all the time. So the way that we get better is we kind of got to like uproot this trauma out of our subconscious mind. And that's what I show you in my free webinar. This is my 13-day protocol. If I had to do everything all over again, this is what I would do, and it's worked on many other people when drugs and diets didn't work. It uproots the trauma, putting your gut in and out of overdrive. But go to my bio link and watch my free webinar. It shows you everything I wish somebody would have told me when I first got sick. Even if you're undiagnosed, it will greatly help you.